This morning at the Vascular and Leg Center to tell us more about who can take advantage of this free screening. Good morning, Josh.
Good morning, guys. That's right. So basically, if you've had tired or achy legs or unsightly legs, as I've read, this is something you might want to sign up for just to make sure you're healthy. And if you're not healthy, you want to make sure you get something done about it. So this is all new to me too. This is an educational experience for me. I just got here and I'm learning all these new words. I feel like I'm trying to learn a second language. But to make a long story short, we're trying to make sure the veins and arteries in our legs are healthy. And there's different conditions that can arise from standing too long over the years or sitting too long. Sometimes it's hereditary, but there's different conditions that can arise which could lead to unhealthy blood flow. So I am here with Kim and Dr. Vinod Kumar. Dr. Kumar, come on over, man. Come on over. So, doctor, first of all, explain to everyone what I am being tested for right now. What exactly is this called? I keep wanting to call it a VCR, but that's not right.
No, actually, it is VRT, which is called, which means venous refill time. Okay. So, what we are able to tell from this machine is if the veins are held in the legs, if the valves are working, if somebody has leg pains, cramps, swelling, itching, any pigmentation, ulcers or any of those symptoms, we can tell from this machine if the veins are responsible for these problems or not.
Okay, all right. So describe what Kim is doing right now. She's squeezing my calf pretty hard.
Right. What we are doing is we are trying to empty the veins, and we'll see how quickly they refill. Okay.
Wow.
And that's what the refill time is. Usually it takes over a minute or so, 40 to 50 or even 60 seconds to refill these veins. That happens slowly. But if the veins are incompetent, then they fill very fast. And so we're going to be able to see whether your veins are competent or not.
So if it fills way too fast, that means my veins have weakened.
Okay. Right. The valves are not functioning. They're not able to hold the blood column, and the blood column falls down. And that's why these veins at the ankle will fill very fast.
Now you say one symptom that people may have unhealthy blood flow in their legs is leg pain. How do you differentiate between like muscle pain and if it's actually coming from veins or arteries?
Well, it's not that difficult because if the veins are a problem, that means they are not able to push all the blood down up to the heart. And so the blood stagnates there, and it shows as swelling or hyperpigmentation. However, if the arteries are a problem, then the blood flow is less downwards. So we'll have lack of swelling and pain at rest or walking, especially, and this is called claudication. Okay. People walk a little bit and they have pain, they have to rest, then walk again, and so this happens.
So it'd be obvious it wouldn't be muscle pain because it'd be so prominent.
Right. It's not difficult.
Okay, Kim, what are the results? I hope it's good.
34 seconds.
What 34 seconds? That sounds like my 400 time. Just kidding.
Well, 34 seconds is good because it's taking, anytime the vein fills within 20 seconds or less, it is abnormal. So that means your valves are functioning.
All right, cool. Now one kind of serious question. Heart disease runs in my family, so I really want to try to take care of myself. Knowing that that's hereditary for me, do you have any recommendations on how to try to keep my blood flow healthy?
Well, it's very important to have a good diet, exercise, and a good lifestyle program. Because obesity is the #1 problem that leads to these unhealthy veins.
Cool. We're going to be with Dr. Kumar all morning. Stick around for throughout the hour. If you want your free screening, I believe they still have 20 to 30 more spots still available. You can call this number 324-4200, and it's from 9 a.m. to 1 p.m. this Saturday. If you're having pain in your legs and you're not really sure what's causing it, or maybe you have some veins that kind of you're not so sure about, come check it out. Come get it looked at. It's free. You have nothing to lose and everything to gain.
Dr. Kumar there with you. I take a long flight back to Massachusetts occasionally. It's about 6 hours, and they do recommend, especially as you get older, to make sure you get out of your seat on the plane and walk around to, to help circulation and that sort of thing. I never really understood why that was. Could you ask the doctor for me briefly?
Yeah, well, absolutely. They explained it to me earlier. Basically, if you're sitting down for too long or for a prolonged period of time, or if they said a lot of maybe they had to get some oil field workers who are on their feet all day long.
Right.
It's not good for circulation, right, doctor?
That's right. Because if you're standing all day, like at the checkout counters, if you are sitting for a long time at one place, then the muscles are not pumping the blood out into the back into the hearts, and the blood stagnates, and these veins dilate. The valves become non-functional, and over the years, yes, it shows up when you are in 30s and 40s. It starts showing up.
Gotcha. Yeah, they told me that usually plus 40 years of age is when the symptoms really start arising.
Right. All right, Josh. Thank you very much.
Thanks,
Appreciate
Rob.
it. Free screening local residents can take advantage of this weekend. What's up, Josh?
Yeah, that's right, Rob. So again, I want to reiterate, this is a learning experience for me. If I get any of these terminologies wrong, I apologize. That's why Dr. Kumar is with me. We're talking leg and vascular conditions. And I just got tested. What was it? It was a VRT.
VRT.
And I passed, right?
You passed it.
Okay.
Yes.
Okay. Well, hey, if you're experiencing any leg conditions, and we're talking varicose veins or just pain in general or unsightly legs, you're not quite sure what's going on. Maybe your feet are cold all the time, or you have some it looks like bruising all over your ankles or your feet or your legs. Come to the free screening on Saturday. We're going to show you a number here pretty soon where you can come, you can make an appointment. It's free screening to get checked out because I had no idea there were so many conditions with circulation that could arise. Dr. Kumar, you have some pictures here that kind of show us maybe what some of these conditions might look like.
Sure. First of all, this VRT that you had, this is the test. If you look at how quickly these veins refill, we can check very easily. It takes only 5 minutes for this test. This is great. Look at this. This is 48 to 51 seconds. That's normal, healthy-looking veins.
Cool.
But
this, what was that? 35 seconds for me?
Yes,
okay.
And very good. You know.
Okay.
So look at this patient. The veins fill within 5 to 8 seconds on the left and the right side. Wow. So this means these veins are very bad. So the blood is not able to be held by these valves. So we need to treat those. Veins.
And when your veins are bad, you get stuff that looks like this.
So this is what happens. If the veins are bad, they get dilated. They start holding the blood down, so the swelling occurs. There is pigmentation into the skin, and eventually the skin breakdown happens. There is ulcer formation, and then these ulcers don't heal for months, you know.
Now, maybe someone's sitting at home and they're like, wow, that's actually me. That looks like my ankle. And maybe they're a little scared. Maybe they're apprehensive about coming in. Talk about the what's it called, angioplasty.
Yes.
It's turning into a pretty common procedure, and it's become very successful for a lot of people.
Right. Actually, for this veins procedure, we don't need to do the angioplasty.
Okay.
What we do is we put a small tiny catheter into these veins, and we try to block these bad veins. It takes 20 to 30 minutes done in the office setting. It used to be that we had to take these patients for surgery and put, take these veins out and cause these ugly scars,
gracious, yeah.
But not anymore. It's a very routine, common procedure done in the office setting. And actually, some people can come in their lunchtime, get the procedure done, and go back to work.
How long do you think the free screening will take? I mean, obviously, it might depend on the condition of the person, but if they just wanted to get checked out really quick, how long can they expect to be here?
The screening itself is about an hour. The patients have to be, or people have to be here for about an hour, because this test takes only 5 minutes.
Cool.
And rest is our evaluation.
The evaluation always takes the longest. But hey, if someone does have this condition or any of these conditions, however, again, let's reiterate just how beneficial it could be to have this taken care of, because you showed me some videos earlier where people you showed me what picture of one man who's been in a wheelchair for 4 years,
right,
and the next day he could walk.
And he could walk, and his son told me that he threw the wheelchair away.
That's awesome. That is so cool. I mean, it's challenging being a doctor. Those success stories just got to be amazing.
Well, that's what keeps us going.
That's right. Hey, stick around. Later on next hour, we're going to show you some more ways to, hopefully get your legs checked out. We're going to poke and prod me, probably, see what happens. I get all weak just thinking about blood.
Queasy,
I'm not going to lie. I like queasy. I know. I like to think that we're just filled with graham cracker or something on the inside. I just
oozing out
queasy.
of us.
It's kind of cute, Josh.
Hey,
graham crackers. Okay.
Yeah, I know.
One quick comment.
Yeah, sure.
These veins problems are very common, and in Kern County, at least 50,000 people have the vein problems.
Wow, no
just
kidding.
in Kern County alone.
No kidding.
25 million people in the United States have these veins problems in various levels of the problems.
So hey, if you're sitting at home watching and you might know of someone, or you're maybe thinking about, hey, I might have a condition I need to get checked out, come on in. Dr. Kumar, he's a very nice guy. He's a professional, people. He knows what he's doing.
Of this free screening. Josh, what's going on?
You're a young pup. You're a young stallion, Rob. You shouldn't be too sore.
I know it. I am. I did a big run yesterday. The good air quality
Okay,
told
all right,
me,
good.
so I ran.
I'm like, hopefully it's for the treadmill. All right, but you want to stay healthy. We're here. They're talking about. It's a good segue there, Rob.
Yeah, Josh, I wasn't like running from the police. I just, I went for a jog. Yeah.
Wait, weren't you?
Well, the reason, if you're just
Or
now tuning
was I?
in, we talked about this last hour, but the reason we're talking about this is because we're talking vascular and leg conditions, and which is way more common than even I had imagined. If you're having leg conditions, maybe you have looks like varicose veins, spider veins, maybe you have looks like light bruising, you get tired and achy easily in your legs, maybe it feels like cramps, especially at nighttime. Dr. Kumar says, Vinod Kumar says that indicator for leg conditions, a big one is nighttime pain. But we want to really emphasize how, I don't want to say easy, but how common these procedures are to take care of these conditions these days to tremendous success. Let's talk about arthrosclerosis and your success stories, because you've had a lot of them.
Yeah, see what happens is if you look at this picture here, the arteries, normal arteries look like this, and slowly the plaque builds up in these arteries and they can block. And once there's blockage in these arteries, then wherever the block is, whether it's in the head and neck, which causes stroke, or heart, which causes heart attacks, if it's in the legs, then it causes leg pains and leg cramps, and eventually a lot of patients end up having amputations, you know. So what happens?
But now these days, you don't have to have amputations many of the time.
Right. Actually, the technology is helping us to get into smaller arteries, just like in the heart. Over the last 20, 30 years, the experience is such good in the heart that we are now translating that experience into the leg arteries, and we are able to open smaller arteries so that we don't have these claudication symptoms or pain at night or cramps and on walking. So we are really able to achieve painless days and restful nights.
And you had this man right here, this guy in the cowboy hat, tremendous success story.
Well, this gentleman who lived in one flight of stairs up, he could not walk up to his room very well without hurting, without having pain. And he would have pain at night. So we were able to do the angiogram here in the office. It's an outpatient procedure. We found there's 90% blockage. We were able to open this, put a stent, and he was able to actually walk without pain. He says it's like having a new pair of legs.
That's amazing. We're already short on time, but stick around. We're going to come back with Dr. Kumar here in a few minutes and really talk about why we're here wearing these vests. All right, we got our protection on because we really want to demonstrate, not literally demonstrate, but just give a quick rundown on what these procedures are like. The angiogram, the angioplasty. Literally, some people get these done on their lunch breaks. I was told it takes maybe an hour or two, right? It's in-house.
The vein procedures, yes, in the lunch breaks. If this is the arteries, if there's a blockage, then it takes a couple of hours.
Cool. Well, still, it's amazing. We want to make sure Kern County is healthy, all right? So if you're having these conditions, there's a free screening this Saturday, 9 a.m. to 1 p.m. Call the number we had on our screen to make an appointment, and it's free. You have nothing else. You have nothing to lose, everything to gain. If you're having pain or you're having symptoms, especially pain at night, this is something. It could mean your veins or your arteries in your legs are becoming weak, and the blood flow is not getting through properly. And it's something these days. Thank God to modern medicine and guys like Dr. Kumar, they can come out here and really help you out and really take care of those conditions for you. So come out here, be healthy. If you have any questions, call that number, guys.
Right now, for people who have spider veins or varicose veins, is pain always associated or only sometimes?
Dr. Kumar, they would like to know if you have spider veins, varicose veins, any type of condition, will there always be pain?
Not necessarily. If there are spider veins, you may have just swelling in the legs. If there are varicose veins, you may just have swelling or pigmentation. And a lot of patients are itching.
Really?
And they may have some cramps or discomfort, various kinds of, let's say, heaviness, symptoms related to the poor circulation.
Got it. Okay, we'll be back in a few minutes, guys. We're not done yet. Stick around for more.
All right, Josh, thanks so much.
Thank you.
Free screening that local residents can take advantage of this weekend. Good morning, Josh. You look like a train conductor.
Yeah.
Good morning, guys. Really, yeah, this is my, I'm wearing my lead, to keep me from the radiation. We don't have it turned on right now. I'm just kind of being goofy. But to kind of just recap what we've talked about this morning, in case you're just now tuning in, there's a free screening here at the Vascular and Leg Center in Bakersfield this Saturday. If you have any leg conditions you think might be arising, you have any symptoms, maybe you have, it looks like bruising, you have pain in your legs, especially at nighttime, and you're not sure what it is, come by and get the free screening. And we want to make sure Kern County stays healthy out there. This is actually a very common problem. Some of these conditions do arise. It's very common, but it's also very common to have a procedure done to alleviate the pain. And Dr. Kumar's here with me. Dr. Vinod Kumar. And Vinod, really, you've had a lot of success stories from people getting up out of wheelchairs, people, they've experienced cold feet and their feet are warm for the first time in years. Let's go over what it takes, what you actually do to cure these conditions. It's pretty fascinating.
Josh, as we talked, it's the plaque buildup, the atherosclerosis process that blocks these arteries, and then the blood circulation stops or slows down. And there's lack of oxygen to this tissue, and they start cramping or aching and having pain during walking or if you sit for a long time. So there are two different conditions, veins and the arteries. We talked about the veins. Now let's talk about a little bit about the arteries that supply the blood down, and if there's a blockage, just like the heart arteries, if there's a heart attack, same thing happens, just like these arteries in the legs. If there's a narrowing or blockage right here, then we can go ahead and put a balloon into these arteries. You see that?
And this is what's amazing. I had no idea that the arteries were big enough, or you had tools even small enough to actually go inside an artery and clear it up. That's amazing.
And after the balloon, you see how these arteries open, how it was before those blockages, and this is the balloon, and we put a stent in these arteries, and they open up. So this circulation restores.
For those that are at home, or maybe they know they have a condition, but they're kind of apprehensive on getting a procedure, what would you tell them?
Well, I think since we are able to do this outpatient in the office setting, that speaks for itself, that they go home within 2 hours after the procedure in the arteries. And the veins, as I said, they come during their lunch break, and they can get the procedure and go back to work.
That's amazing. And you actually have some stents with you right now. I've always wondered what a stent looks like. It's huge. I had no idea the arteries in the leg were this big.
Right. Actually, in the heart, the artery size is about 1/3.
Okay.
But look at this, about 7 to 8 millimeter stents, and this is a metal sleeve that once you put in the arteries keeps the vessel open.
And most of the time, these things have lifetime warranties. I mean, you don't have to change them every 2,000 miles.
No, okay. Not like that. But sometimes, if the process of blockage is not reversed, just like diet, lifestyle changes, and controlling the diabetes or high blood pressure, then these will continue to block again and again. So we have a plan for patients where once we open these arteries, then if they follow that, and most of the patients are following those, once they have the symptoms, they get better, they know that's going to get worse. So if they change their lifestyle, it works very, very well.
People at risk are those that may be overweight, those that have been standing for extended periods of time over the years, or sitting for extended periods of time over the years, diabetics, people above the age of 40. So if you have any symptoms, smoking, high blood pressure, Dr. Kumar says, if you have any of these symptoms, we're talking bruising, varicose veins, just pain and weakness, you get fatigued very easily, come to the free screening on Saturday, get it looked at. And again, final notes, Dr. Kumar, thanks again for having us this morning. Any final notes as far as just to reiterate how common the procedure is and to make sure we stay healthy?
What I like to say is leg pains, leg cramps, leg swellings, itching, burning, numbness, if there's any swelling in these legs, any of those symptoms if people have, they should know that there is a treatment available. The diagnosis is very easy. It all can be done outpatient basis.
And Dr. Kumar has been pretty modest this morning. I've read some things about him. He's very renowned. You actually won an award from was it Congress?
United States Congress. And I was the recipient of an award from the Bakersfield Nurse Practitioner Association for Physician of the Year, also from the Central California Heart Institute.
So guys, he's legit. He's legit, ladies and gentlemen. Yeah, UCLA makes some good products. That's where we went to school. So, hey, I'm bragging on him, but he's a really nice guy. But if you have any of these conditions, check out the free screening on Saturday. Again, I can't say it enough. You have everything to gain and nothing to lose. Rob, Linda?
All right. Thank you, Josh.
That's good stuff, Josh. I've got my feet up. I'm elevating right now, Josh. I don't know if you can see it on camera, but, we sit so long here that now I need to make sure that I'm circulating properly. Thank you, Josh.